Welcome, everyone. Hi, it's Dr. Shah from the Vale Medical Practice. I'm joined today by two members of the Rural Community Charity, the RCC, in Bedfordshire. We've got Bill Simmons here, who's head of the Community Transport organisation, and also Mandy Setterfield, who's our social prescriber. So welcome both. We just going to have a short conversation about who you are, the sort of services you offer, and how that might benefit our patients and residents. So tell me first, who are you? What is Bed's RCC?
Bedfordshire Rural Communities Charity is a people-focused charity that covers rural areas in Bedfordshire, but we also cover Bedford. We're not limited to rural areas, but that is definitely where we can deliver some great value with a range of services, including Walks for Health, Good Neighbour schemes. We run a vineyard. We do all kinds of work, including social prescribing and transport.
Fantastic. And Mandy, tell me about the social prescriber role.
Our focus is on helping people improve their well-being, which is quite a wide remit, really. So we might work with someone on sleep issues. We can refer them to other organisations where they can get fitter, exercise, lose weight. It is a wide remit. We are a very good listening ear, and we like to begin just by listening to our clients. We work with any adult, so anyone aged 18 and over. So it's a universal service for adults. You don't have to wait to be referred. You can refer yourself to social prescribing. It's particularly good for people experiencing isolation, loneliness, mild mental health difficulties. So it's quite we're always happy to listen to someone's story and then kind of judge what might suit people. So we kind of make an offer to patients, and it's always up to the patient what they choose and what they want to do. It's very person-centered. We never force anyone to do anything. That's not our way.
Fantastic. That's wonderful. I mean, certainly when I think about the communities we serve at the Vale Medical Practice, there are two aspects really. Just touching on what you said, we obviously have a huge rural community, and often there are issues of sort of loneliness and isolation, which can happen. Being far away from other sort of communities. But actually, what we've also found is that even in some of the built-up areas, because there's a lot of new families coming into the areas who don't necessarily have networks or roots in the area, there's a lot of sort of loneliness actually as well. So it's quite interesting that you can help on that aspect, which is really interesting. What we've done is we've come up with a few questions, and so I'm gonna ask you them in turn, and let's see what comes of this conversation then. So first, I suppose to you, Bill. So you're in charge of the door-to-door service. So what is this exactly, and how can that benefit patients, especially if they're trying to reach an organisation like ours, a GP surgery or a hospital service? Tell us more.
Yeah, so we operate a transport scheme that is known as a dial-a-ride scheme. It's an official term. It's part of the Department for Transport legislation coming under something called Section 19. This is more information than you need to know, but the reason for explaining that is it's not technically a service offered to the public. Everybody that uses our scheme has to become a member of the scheme. The qualifying criteria to be a member of the scheme is it's open to people who are unable to use public transport. And in Bedford Borough, that means that they are physically, there's a condition, a health condition that prevents them using public transport. So it's not that there is no bus service. It's got to be that they are unable to use a bus service regardless of whether a bus service exists or not. The dial-a-ride scheme is called that because people ring up and they book journeys up to 2 weeks in advance. Whilst we do take people to medical appointments, hospital and GP, it is not limited to that. Almost everything we do is, in addition to health and well-being, it's very much about reducing social isolation and increasing people's independence. So we take people shopping, hairdresser appointments, meeting friends, going to the bank or the post office. There's a membership fee every year. It's £20, and then journeys start at £5 each way. We have 5 wheelchair accessible minibuses. Every bus has a tail lift. So if you've got patients that are struggling with their mobility, they may not be in a wheelchair, but they may be frail, or they may be using walking equipment, but also wheelchairs or mobility scooters, they can travel with us in our bus. There is lots of floor space, and about 40% of our passengers are wheelchair users, and a large proportion of people are people who perhaps struggle with walking long distances.
No, that's really helpful. So it's beyond going to the GP or to the hospital clinic appointment. It's also for social things and getting yourself out and about, which is fantastic.
Yes.
So you mentioned that you need to have an underlying condition. Can being frail or having arthritis or a general term like that be enough, or do you need a doctor's letter or something, or can you self-attest as to what your issue, what the underlying issue is?
That's a great question. The rules are set by Bedford Borough Council, who give us, they contribute towards our running costs. The current criteria states that if they are over state pension age, they can self-declare themselves unable to use public transport. If they are under state pension age, there is a form that I can send you, but it will be sent to any interested member. And if they're under state pension age, there is a form the GP needs to sign to confirm that the person is unable to use public transport in the GP's opinion.
Okay, so that's quite a straightforward thing that can be organised. And what is it quite well taken up at the moment, or are you finding that actually people just don't know about this service, and actually you could help people more?
I think there's definitely more we could do. We're not intentionally a secret service, but I think there's a lot of people that are, when they learn about our service, they're pleasantly surprised. We find it very hard to reach the right target audience. But those that know about us use us frequently and regularly. I'm not entirely sure how we reach the people. I mean, one great way is through GP surgeries, but we take people. So there's an awful lot of transport we do. As an example, focusing on health for a minute, we take an awful lot of people to Headway. We take a lot of people to the MS Centre. There's kind of 4 or 5 very popular health destinations, and those organisations know us well. But my gut feeling is there are lots of places out there that need to know about us, that we don't reach. We focused recently on supported living accommodation, particularly where we've seen bus routes be withdrawn. We've kind of tried to target independent living. So I spoke recently in Kempston to a place with independent living flats and spoke about our service. But what I would say is that a lot of people at a retirement age are used to using a bus pass and travelling for free. So when their circumstances change and they qualify for our service, they can be frustrated that our service is not free. We don't accept a bus pass and then allow people to travel for free. No, but we are reasonably priced. We are much cheaper than a taxi. We carry shopping. We help people get in and out of their door and secure their property. So that we are just to give you an example, in case your colleagues are interested. So my drivers they are not multi-drop drivers. They are not delivering parcels and they decided to work for us. They are people. So I've got ex-fire service, ex-ambulance, ex-police, ex-mental health nurse, ex-postie, ex-dentist. The drivers at the moment, they're all men, but they're all professional people who've had a career. The average age of my drivers, not that in this modern age it's relevant, but average age of my drivers is probably about 60.
Okay.
And they love a conversation. So your
So
patients,
I'm hearing they have the human touch, which is always nice.
They absolutely do. There will be good conversations, or banter, as we might call it. The bus becomes a social place of.
So it's like having a London cabbie.
Absolutely, there will be discussions. Yeah, the drivers and the passengers like to talk. Some of our passengers have been with us for a long time. We've seen their stages of life, for sometimes 10, 15 years of traveling with us.
Yeah, that's fantastic. I mean, that's the whole point of these sort of webinars that we're trying to organize at the Vale Medical Practice, because we find that there are so many of these sort of brilliant organizations like yourself who are doing lots of great things, but no one seems to know about you, or they just can't get through. And so we're hoping through our website and our social media that we can use that to try and spread this sort of very positive message and try and reach as many people as possible. Because even if people don't necessarily watch this because they don't necessarily subscribe to Facebook or whatever, someone else who knows them might do, and they might be able to sort of direct them in the right way. So I'm hoping something positive will come out of this sort of work that we're doing. I think you've answered most of the questions that I had about the transport service, except how does someone actually go about booking on? Because I remember you showing me this wonderful map about the different zones and things like that. So we'll definitely, if you can send that to me, and we'll share that on the link on the show notes. But just in a few words, patients can self-refer obviously themselves to this.
They can. There's an application pack we would send them. We can send it electronically or in the post. They fill out the form. We process the form. They no money changes hands on the buses ever. People pay for their journeys in arrear over the phone by card. It's a paper application form. If they're tech savvy, they can fill out the form electronically and email it to us. The one thing I would say, going back to all these kind of secret services that are not known, Mandy is the person that knows all these organisations. So a referral to social prescribing is the way forward to connect to these unknown saints that provide amazing services across the community.
That's a fantastic signpost to the next series of questions. So great.
I'm part of a team of about is there about 16 or 18 social prescribers across Bedfordshire. So I think that's a really huge pool of knowledge. I think it's one of our strengths, really, that we do we kind of work together to a certain extent. And so actually, we know about all these hidden gems.
So what is, if I hadn't heard of what I mean, the social prescribers are now becoming more of a known entity, if I can put it in that way. But if you go back 2 or 3 years, people wouldn't know what it is. So if I'm one of these people who didn't know what a social prescriber is, what is a social prescriber?
It's a person with really good knowledge of your local area that you can talk to about difficulties you're having or experiences you've had, and who can support you to improve your well-being in whatever way feels right for the client. Someone might want to get fitter, someone might want to get out more, someone might want it's it's so varied, really. Anything that impacts health, we will always try to find a way. We're really good researchers as well.
So you're quite inquisitive. You're quite inquisitive, I suppose. You say if a patient comes with a problem, you're as I understand it, you will make it your business to try and find something that helps them in whatever way, whether it's their physical health or mental health and everything in between.
Absolutely. Yes. We're very good listeners. And I think speaking for myself, I have a really firm belief that everyone has great potential you know, and I think I love listening to people, listening to their story, encouraging them, almost, I mean, I was going to say holding their hand, and it's not as kind of, that's not the right way of putting it, but we do try to kind of support people while they are reaching out, trying to find a way to improve things. You know, it might be about housing, it might be about debt, money, all of those, you know, all of those things are so crucial, because actually inappropriate housing and being in debt, those things are so stressful and will really impact any other health condition that you have. You know, whether you have a disability, a mental health condition, you know, stress will not improve that. So we're really about helping people to reach out, to find support. You know, we can offer a lot of reassurance, we can encourage. Yeah.
So because we are in quite a rural area, but obviously, as I said, there are some bits of that are built up as well. Are there any unique areas or themes that you see because of the rurality, or because, like I said, we have lots of areas where there are new communities joining us, so like in Shortstown or in Wixham's, where people don't have any of those sort of traditional roots? Do you find there are common themes that you're seeing that people maybe listening to this might think, that might be something that can help me?
Yes, I think, I mean, Shortstown, I think there is more going on in Shortstown now. Along with my colleague Wendy, she's the village agent for Shortstown, and we run a lunchtime club once a month. That was yesterday. And that is available for anyone to drop in, come and have a bite to eat with us. And people have made really good friendships there. There's a lovely buzz. It's a really enjoyable event, and we're welcoming. We love seeing new people. Rural areas are more difficult. There are some areas where I think new houses have been built, and there isn't supporting infrastructure, in particular social infrastructure. And our boss does report back to the local authority on that. So one of the things we do as social prescribers is actually look for gaps.
Sure.
So, you know, rural areas are difficult. Transport is difficult. I mean, obviously, we've got the door-to-door service. There are lots of good neighbour schemes based in villages. They can often help with transport to medical appointments. There is a patient hospital service, a patient transport service at the hospital. And I'm not sure what their criteria are, but if someone did approach me, I would research it. I'd be on the phone. Yeah, so there isn't a good neighbour. Yeah, there isn't a good neighbour service in Shortstown, and BRCC has tried on occasion to get one set up, and it is proved difficult. So yeah, there are some gaps in those kinds of services, but
And how do you find in newer communities, such as in Wixham's? I mean, it's not that new, to be fair, but obviously there's developments being added on all the time. Do you find anything, any sort of themes that come up that might be helpful to sort of discuss?
Do you know, there is I don't know, I don't like to kind of, well, there is a particular part of Wixham's. It's the part that lies a bit west of Wixham's and north of Houghton Conquest. A lot of new housing has been built. I've had clients who are new mums, who are disabled, and, you know, they feel like socially they are isolated. There isn't a village hall, so there's no local coffee mornings. If someone can walk or bus to Wixham's or the other way into Flitwick, Ampthill, then there are places to go. But I think if you have a young mum with a buggy and no car, the buses are not that frequent. It's a gap. There are gaps. As I say, that is something that we are trained to look out for.
No, that's really helpful. I know buses, especially at the moment, is quite topical. And of course, this is completely apolitical, so we're not making any sort of comments beyond that. But it is very much a fact that buses are a big part of trying to help people, and get people out, so that they can do the things that they want to do. So and that's one of the reasons we want to try and connect with people like yourselves and see how we can try and help our patients. I mean, we've found, certainly as GPs, there are so many medical conditions which, we as doctors have exhausted together with our hospital colleagues in terms of what we can do medically with medications and procedures, operations, lotions, potions, all that kind of thing. But it comes a point where we're kind of at the ceiling of what we can do, or there's not that much, there's sort of incremental gains we can get. But actually, what most people need is just a bit of reassurance, or they need just a bit of help with some of the social side of things, or just someone to listen to, like you're saying, a sympathetic ear, which we can do to an extent as GPs. But of course, we're limited as well because of some of the challenges we have with just the normal medical problems. That's sort of the normal grind, if you like, of being in a GP practice. And that's why we found it extremely helpful to have the sort of social prescriber service, so that we can tap people into people like yourself and organizations like yourself where they need that little bit more. And so we certainly wouldn't want to flood a service like yourself, because the worst thing you can do is create your own problem where there's a huge influx of demand. But if patients did want to, or residents did want to refer themselves to yourself, obviously we can do that too if we come across them. But how can they do that? Is there a website or a form that they can do that with?
Yeah, we're very happy to receive self-referrals. People can go to Your Wellbeing Bedfordshire.
We'll share all of this in the show notes.
Is it .org.uk? And if you click on the button for one-to-one support, there's a really simple online form to fill in. It's quite straightforward, name, date of birth, basic information, and then just like one sentence regarding what it is you want to talk to us about. Is it about money? Is it about housing? Is it about poor sleep and stress? And then I normally don't have a waiting list. The service has been busy recently, but we normally aim to make an initial contact within about 3 working days of a referral, and to do an assessment within about 10 working days of a referral. I sometimes feel that, we have the time that surgery staff might not have, due to the pressures you're under. So we can normally offer up to 6 sessions, and an initial assessment. I'm happy to listen to someone's story for the best part of an hour, really, just to kind of get an understanding of where someone is and how they want to move forward.
No, that's like I say, it's a very it's almost like an extension of what we're doing, that if people need that little bit more. And what I love about your service is that you will find something that helps someone for their sort of specific needs, which may not be sort of it might be sort of very fringe or very niche, that helps them with their particular set of needs or problems. So that's fantastic. I'm going to bring this to a close, but before I do so, I'm just going to ask you one final question, Mandy, if I may, which is, what do you think, because we're always keen to take on feedback, what do you think organizations like ours, GP surgeries, what can we do? And this goes to you, Bill, as well, because I know you have great insights into this. What can we do to try and connect patients, residents, especially factoring things like rurality, as we talked about, and also being new to an area, to try and connect them to services like yourself? Is there any ideas that you have for us that we can think about and take away?
I think it would be really good to make sure that the social prescribing service is publicised. So obviously this webinar is going to be good for that, but to make sure it's publicised on your website, in the surgery, yeah, and just to let people know that the service does exist. I think social prescribing is really gaining ground. You know, it's a nationwide thing now. Yeah, but you know, it's yeah, I think it's always worth someone kind of having a conversation with us, you know, just to see, you know, if we can help them with their goals. It is a kind of a goal-orientated service, I suppose. So we always have to have the patient's consent, and it's really about what they want to change. That's the thrust of it.
That's lovely. Bill, do you have anything that you want to add to?
I think Mandy is hit the nail on the head with just, we've said it multiple times, but I think that Mandy and Mandy's role is just people that are very well connected to the community. There's a couple of organisations that facilitate online meetings where all of these agencies come together, and but Mandy has done all of that work for you and your colleagues. There are all kinds of features about a patient that might unlock certain organisations. So Mandy, correct me if I'm wrong, but I think if someone has, for example, served one day in the armed forces, there is an organisation that will help them more than some other organisation. If somebody has ever been sectioned under the Mental Health Act, they are entitled to certain. So Mandy will find out the information that you cannot. Exactly. In your 6 minute or 10 minute slot that you've got, Mandy, hearing Mandy say that she'll spend up to an hour. It is amazing. Obviously, I'm wearing a transport hat here. I did start with Bedfordshire All Communities Charity as a social prescriber. So, but from a transport perspective, we would love to help your patients. Similarly to Mandy, when people ask us, I need to get here, I need to get there, we are connected to other organisations that provide transport. But I mean, Mandy is the answer to the question, really. But from a transport perspective, and particularly if you're trying to get people to hospital, or perhaps hospital out of county, I have a number of resources that, Mandy, I can pass to you. But I'm always happy to help. Our general inquiries number just for transport is 01234 834 933. There is that kind of, for our organisation, the need to become a member is sometimes problematic for someone that perhaps is very capable of driving, but they've got one appointment at Moorfields. We are probably not the solution for them, but we will know other transport solutions. Not saying that we will find someone who can transport them, but we definitely will have other organisations that might be able to help, that operate in a similar area to us.
That's fantastic. Both of you obviously going that extra mile, which is just wonderful to hear. It's so nice that we have organisations and people like you locally here. So thank you very much. Thanks for joining me today. I think that's been a really helpful session. I hope the people watching this will find it helpful and useful too. I'm going to be sharing some of those links and contacts in the show notes. So if people do want to make contact, they can do so. But otherwise, on my behalf and on behalf of the Vale Medical Practice, thanks for joining us today.
Thanks for inviting us.
Pleasure. Thank you.
Take care. See you soon. Bye.
Cheers.
Bye.